I had once a call from my liver intensive care unit where I was told that a young man, he was around 39 years of age, he was admitted in a very critical state. So I rushed to see him in the ICU and I saw that this man was already intubated, meaning there was a tube going in through his windpipe into the lungs so as to push oxygen into his lungs to keep him alive. And he was hooked onto a ventilator. There were multiple medications going on, and I was just trying to figure out why this is happening so fast. The patient had presented to the emergency department hardly 2 hours before, and when he was in the emergency, he was disoriented. His blood pressure was unrecordable. He was bleeding profusely into his mouth in the oral cavity. Wherever they tried to find a line and put a needle in, that site was also bleeding, which means his blood's clotting function had completely vaporized. And while they were investigating him in the emergency, they did a particular test known as ABG, which is arterial blood gas analysis. So you take some amount of blood from the artery, not the vein. Usually we sample blood from the vein, but this is from an artery. And this blood is subjected to a test where you actually can find out the levels of acid and alkali in the blood. Also some of the electrolytes like sodium, potassium, and some of the waste products in the body, which happens in critical illness, which is known as lactate. That is lactic acid. So when the body is under stress, lactic acid increases. When the kidneys are failing, the acid levels in the blood increases. It is a condition known as metabolic acidosis. And the sodium and potassium and all those electrolytes will just go haywire. So in this man, emergency doctors found out that his lactate was very high. Normally, we would expect lactate to be below 2, ideally, sometimes even less than 1 in very stable patients. But in him, it was 10, which is 10 times the normal values that we consider. And also, his acid levels were quite high. So the pH of the blood, where we look at acidic or alkaline nature of the blood, his pH was just 6.8, which is severely acidic. And he was not responding well. He was mumbling, disoriented, and his blood pressure was not recordable. So the doctors, they just sprang into action. I mean, every time spent in the emergency is very, very valuable. It's patients present in the emergency, and that is a golden window where you can do a lot for these patients. So the doctors just jumped on this patient, trying to stabilize him. They put in lines, they rushed in fluids, they started him on medications to get a recordable blood pressure. They put him on a ventilator to protect his airway, to give him support. They did all of that in less than half an hour. And then rushed this patient to the intensive care unit where the rest of the investigations and evaluation and the whole investigative part of medical management about what happened to this man would take place. So the critical care team saw that this man was already in multiple organ failure. Within a few hours, he rapidly developed multiple organ failure. So the whole story started just 2 days before when this man started having fever. He used to work in the IT field, Monday to Fridays completely in the office, and Saturday, Sundays they used to get off, and he used to enjoy himself with his friends on Saturdays and Sunday. Just a couple of days before he started developing fever, and they all thought it was just a passing flu, a seasonal illness, and he was just at home and taking a couple of paracetamol tablets to get the fever down. But a day later, his fever actually increased. It started spiking badly. It was about 102 degrees. And then that is when they showed him to a clinic nearby where they stayed. And all these people, they stayed together in a hostel-like accommodation. And the doctor in the clinic admitted him there for a few hours and sent his bloods, started him on some IV fluids and gave him some medications for the fever. So everybody thought it's a recent onset fever, and it could be anything from a dengue fever or a simple flu. And at that time, this man was not looking very toxic. He was not very sick looking. But a few hours later, he vomited badly in the clinic inpatient. And after that, he was so lethargic and he was not well oriented. So the doctors there knew that there is something more going on in him, and they referred him immediately to the nearest multi-specialty hospital. and they came to us. But the travel was about a couple of hours in an ambulance, and during that time, he was continued on these IV fluids and medications for the fever, and they also started him on an antibiotic there. So an antibiotic which belongs to the group known as cephalosporins, which is a standard antibiotic broad spectrum. It works against a lot of bacteria, that is why it is known as a broad spectrum antibiotic, which was given to him. And they transferred him to our center. But by the time he reached our center, he was already so sick, and he had to be rapidly put on ventilator and multiple organ support. So just 2 days, a few episodes of fever, this man collapses. In another few hours' time, he is on a ventilator, and in another few hours' time, he is in the ICU fighting for his life. So we sent out all these bloods, every common infection that we usually look for: dengue fever, malaria, leptospirosis, which is a disease caused by an organism which happens mostly in Kerala, where there is patients present with jaundice and kidney failure and multiple organ failures rapidly, condition known as leptospirosis. But even that was negative. So malaria negative, dengue fever negative, leptospirosis negative, and everything that we check for from a virus infection point of view came out negative. Then we saw that a chest X-ray done at admission. After they put in the lines, they do a chest X-ray to see if the lines are in place. These are central lines that go through the neck vein. That X-ray showed a small patch in the lower part of the right lung. And one of the blood cultures that we sent a few hours later was told that there was some organism positive in that. So there are these blood culture methods where we can actually see if there is something growing quickly. But what that particular organism is, we need to have at least 48 hours to identify, because we have to culture that particular organism. But there was something growing, and that alert was given by the machine. And so we put him on multiple antibiotics just to cover everything. This is like a life and death situation. But none of these antibiotics actually worked on him. And rapidly, his kidney failure progressed so rapidly that his acidosis led to something known as arrhythmias. So basically his kidneys were shutting down. He was severely acidotic. His blood levels of acids were very high. His potassium was very high. His sodium was very low. So this leads to rhythm abnormalities and pumping problems in the heart. And slow and steady, his heart rate and rhythm started varying. It started going up and down, sometimes very low, sometimes very high. We gave him medications to get his heart rate right, but then it was not getting corrected, and he quickly went into cardiac arrest. So suddenly his heart stopped. So one of the staff nurses, they got on top of him and started giving him chest compressions, while other doctors on the side started giving him medications known as inotropes and vasopressors so as to get his heart pumping again. And after a few compressions, we got a heart rate again, but the rhythm was not normal. We put him on medications to get his rhythm right. And while this was going on, again he went into a cardiac arrest. And unfortunately, this young man died. And this was completely unexpected. He was the younger brother to two elder sisters. His parents were working in and around Kochi, and they were all waiting outside to know what was happening. And it had been just 9 hours or so in the hospital, and he's dead. So rapid onset of fever, followed by multiple organ failure, and this man is dead. No other diseases. He was not on any medications. The parents did not know that. Gave us no history concerning any medication that he was already on. He was a very healthy, fit man. He used to work out in the gym. He used to play sports. He used to love table tennis, and sometimes he used to go and play squash. But this man is dead. And we slow and steady conveyed the news that this person is really sick, and he's not responding to our medications. And it's a difficult art form in clinical medicine to counsel patients, family regarding death or an impending death. It's quite difficult. We did repeated counselings regarding how his health was deteriorating, and slow and steady we laid it out that he's not going to make it. It was a terrible scene because a young man just dying suddenly. He was just talking to them a couple of days before, and now he's no more. But then we need to see what was happening. And after his death, we wrote the summary as bacteremic infection. Bacteremia means something was growing inside his blood, an organism, possibly a bacteria. And that has led to multiple organ failure, and he died. So that was the diagnosis at that. And they took his body and cremated him a few days later. So we went back and saw what was growing inside his blood. And it was an organism known as Klebsiella. So it's a terrifying bacteria, and people can get it from the community. Sometimes it can infect people in hospital setting also, where it's usually multi-drug resistant in the hospital setting, but in the community setting, usually it is not multi-drug resistant. But with the way we are using antibiotics right, left, and center for cough and cold and all viral sore throats, it's a matter of time that Klebsiella is already here in the community in its drug-resistant state and ready to kill. So why was this man suddenly affected with Klebsiella? And the Klebsiella entered his bloodstream and without any hesitation, rapidly damaged all his organs and ultimately killed him. The history that we took gave us clues to this. This man used to drink alcohol on weekends only. So there are alcohol users who drink alcohol every day. There are alcohol users who don't drink alcohol every day but drink every week or maybe every month, but then they drink heavily. And then there are these weekend socializing alcohol users. So this man was a weekend drinker. He used to consume about 3 to 4 pegs. So one peg for him was 60 ml. So that was about 240 ml on a Saturday and a Sunday. So that's close to 400 to 500 ml in 2 days' time. And he used to enjoy the drinks and he used to party with his friends. And he never used to get drunk and he never used to drink on weekdays. He was very controlled. So it's just Saturday and Sunday and that was it. He stuck to that principle of enjoying the drink and enjoying a healthy way of drinking, so to call it. But then there is something more to that. And I think this is very important. In 1995, there was a study from Taiwan in which researchers at a tertiary care hospital found out that many young men entered their emergency medicine department very sick with pneumonia. And this pneumonia, in some of them, about 11 of them, were associated with bacteremia. That is, the organism that caused the pneumonia was actually entering not the lungs, but also entering the bloodstream. And when it did that, and it entered the bloodstream, it led to rapid onset organ failures, and all these 11 patients with bacteremia died. And the bacteria that caused it was Klebsiella. And all the men who developed bacteremia because of Klebsiella and died were alcohol users. And some of them were heavy users, some of them were alcohol users, not significant, but still they used to consume alcohol frequently and regularly, in the sense that if it was weekends, they used to consume on weekends and sometimes heavily on weekends. And Klebsiella bacteremia was found to be a number one killer in patients who consume alcohol. So why was this happening? In the year 2001, a group of researchers from New Orleans, they published a study. This was an animal study. And what they found out was that when they fed rats alcohol, so they give alcohol to rats through a gavage, or they mix alcohol in water and feed it to rats. And rats have a very great attraction towards alcohol, just like humans. So they drink alcohol quite a bit. So when they fed alcohol to rats, and they looked at how the immune system in rats were functioning compared to a group of rats who did not consume alcohol, they found out that specific white blood cells in the spleen, there is an organ known as the spleen on the left side of our body. It has a lot of immune cells in it. It's one of the major organs that provides immune power to our body, protects us from a lot of bacteria, fungi, and other organisms. So a particular group of white cells known as splenocytes, which is supposed to protect us from Klebsiella pneumonia when the bacteria attacks our lung. So in these rats, when they infected these rats with Klebsiella pneumonia, the white blood cells are supposed to release a chemical known as IL-17, which is interleukin 17. It's like an arrow that we send against an enemy. So these white blood cells have lots of arrows, lots of types of arrows inside them. So interleukins are one of those types of arrows which have anti-inflammatory effects and can kill the invading pathogen or the organism. So in these rats, the IL-17, interleukin 17 expression was very, very low, especially in those rats that were consuming alcohol, which means that immune defense against Klebsiella pneumonia and the inflammation and the swelling and the damage that this bacteria was causing in the lung was much higher in the rats that were consuming alcohol. Now, this was very important. So they found out that alcohol actually brings our defenses down, and we are predisposed to more infections. And this was finally solved. This huge puzzle was finally solved in 2017 when another group of researchers from Louisiana, which is New Orleans, they figured out something very cleverly. So what they did was they took a group of mice and gave them a lot of antibiotics. It's known as an antibiotic cocktail, which led to complete destruction of all the organisms, the bacteria inside their small intestine, in the gut. So their gut was actually sterile. It was free of bacteria. So they kept these mice on one side. Then they took another group of mice and they continuously fed them alcohol. And what they did was they took the feces, the stool, from the mice who consumed alcohol and gave it to the mice who are now sterile, that they did not have any organisms in their gut. And to another group of sterile mice, they gave stool from healthy mice, that is, mice who did not drink alcohol. And they infected both of them with Klebsiella. Now see what happened. It's very interesting. So the mice who did not receive stool from alcoholic mice, when they were infected with Klebsiella, their bodies could fight Klebsiella better. But compared to the other group of mice, the sterile mice who were fed the stool from the mice who drank alcohol, when Klebsiella invaded their bodies, they could not fight it off, as much as they wanted it to. And a lot of these mice actually died because of the Klebsiella infection. So what alcohol does is, from this study, what they identified is that when alcohol gets into our bodies, it completely changes the microorganism environment inside our guts. You have all these bad bacteria and bad stuff going on in the gut because of alcohol's presence. And all the good guys who are supposed to protect us, who are supposed to release good chemicals to protect us from invading pathogens and bacteria and all, they become depleted, they become lower. So this is known as dysbiosis, where a balance between good and bad bacteria is completely lost, or good and bad microorganisms in the gut is completely lost in the presence of alcohol, because of which that animal is predisposed to an increased risk of infection, specifically from Klebsiella, in the lung, and they die. And what they found out additionally was that the lung defenses, that is, when the Klebsiella started attacking the lung defenses against the inflammation or the bacterial products, the damaging bacterial products, the lung defenses were also completely down in these mice who were fed stool from the alcoholic mice. And they had no defense left, and more than 90% of these mice actually died. This person, even though he was not an alcoholic or a heavy alcoholic, but he was a regular consumer of alcohol on weekends, his defenses were down. His defenses were down so much that a community-acquired pneumonia, especially from Klebsiella, killed him in a matter of less than 12 hours. So it's very important for us to remember that when we think about alcohol use and when people drink alcohol, I'm sure socialization gets a big thumbs up. People feel happy. And that's just alcohol playing with your brain. But there are other things happening to your body, and this is something that you don't realize. That is your immune system. So the immune system gets severely affected when people consume alcohol. And without you even recognizing or realizing, your immune defenses are down. And once they're down, the predators, the small, minute predators that you cannot even see with your eyes, they're all waiting to invade your bodies and kill you. So please remember that alcohol use is in no way healthy. There is no healthy dose of alcohol. There are no health benefits of alcohol. And even in occasional consumers, weekend drinkers, social drinkers, alcohol can still get your immune defenses down, and you can unfortunately develop severe infections that can just kill you without warning. And I think this is important because everybody that we talk about alcohol, almost all of the people that I deal with when it comes to alcohol, they always think about the livers. It's not just the liver. Alcohol is a systemic poison. It can affect your hair to toe. And one of the things that you did not know that it can affect really bad is your immune system. Which is why one of the most important risk factors for tuberculosis, which is a chronic bacterial infection that kills many, many, many humans in India, is alcohol use. So alcohol use predisposes not just to Klebsiella, but other major severe bacteria like Mycobacterium tuberculosis also. So please remember the story of this young man who died, unfortunately, and we could not do anything. We were just spectators while the bacteria ravaged his body, destroyed his internal organs, so much that he was bleeding from almost all orifices and died a really, really bad death. And his loss, his parents has to suffer, his siblings has to suffer their whole lives. So please remember that your immune defenses will be taken down by any level of alcohol. So stay safe, be healthy, and switch to water and exercise well. Until next time, with a new patient story from the hospital, take care and good luck.